All I can say is that Up Walk warms you to the core. Feel that magic that happens when we're all here together working as a team and helping each other.
Good. Okay. Well, hopefully this one's the same.
Seeing that some of these patients have been waiting for 10 to 12 years, enduring a lot of this pain, and then finally being told that they're able to get the surgery and they start tearing up and release a lot of emotion during that time, it makes you realize that you're really doing something that's quite impressionable.
During the clinic where we saw 80 to 100 patients, I remember there was a 40-year-old lady who had terrible bilateral hip AVN, and it's affecting her whole family. Telling her that she might be a candidate for surgery and we can do this in the next few days is changing her whole world. And that's the reason why this is so special.
I mean, I think I was surprised by the scope, like how ambitious the project was. I mean, prep team came on Wednesday and they only had till like Saturday. So like in a week and a half to do all this for all these people, just the scope itself is just really impressive.
This year, I think we shipped down 13 pallets, and we put all the equipment out throughout the entire hospital. It's a hard couple of days, but then when the full team comes down, the hospital's set up, good to go, and on Sunday morning, we start to work.
Okay, so patient 4 is actually going to go next, but it's the same side and the same. Okay, what's their number?
The easiest tip we do here would be a bad day at home. These patients are born with dysplasia. They don't have the early detection that we have in the United States.
A lot of the people back at home would get this taken care of as a child to correct some of the bone growing, and here they don't have that.
Because they're developmental, they're from birth, these patients are often quite young. We have patients that are 30, 32 years old. They can't really function in society. It's hard for them to have kids or play with their kids or provide for their families. So seeing these patients be able to get up and walk without pain and then hopefully be able to quickly become productive in society for their family, and just really will change their life.
You see what would have happened if we don't do it back in the States. So it's challenging because they don't have that early intervention that we just take for granted.
I always warn our team leaders, every year we have at least one big challenge, and big challenge meaning it could compromise the trip.
We're often doing 6 hips in one room on one day. And again, the difficulty of these cases is very, very high.
Like the toughest one I did this year was 2 knees, and the arc of motion was basically 30 to 80, so they couldn't be right angle like dangling in a seat. They're sitting out. And that's a hair-raising one because you have to be technically good and pay attention, and it worked perfect. So it was a learning experience. I don't think I'll have to use that again, but it's in my toolkit now, and you can learn from each other's tough cases.
It's really special having residents in the operating room. They see pathology here that is well beyond what they're seeing on an everyday basis back in the United States. And I think it's really great for them to experience the anatomy that you just don't see back home in terms of the severity of disease. But I think it's even more important that they see the impact that these surgeries have on the patients and their families. I think that's the message of why we all went into this profession to begin with. Every day I've made a point of going and seeing every single patient who was part of their care. Inevitably you see them, they break down in tears of happiness. They're so grateful. I think I've been blessed about 15 times this trip already. Those memories I'm going to cherish lifelong.
One of our first patients was just a rock star. She had bilateral hip replacements, which we don't see a lot of at Sanford and Fargo, and she was up walking right away, didn't complain of any pain. She's going home today and just had her surgery yesterday, so it's pretty impressive.
The way the physical therapists, the nursing staff, the physicians, the volunteers, just all of them just like flocking on the patients and just like giving them all the care that they need and they deserve.
It's healthcare at its purest form. It is a person who needs, and I have the ability to give.
Everyone having that common shared goal of just being here to help other people is really special. We're helping the local community as best we can.
You think about it, you know, we have 80 people that come from many different parts of the country that never worked together, ever. And you hit the ground running on Saturday and you take care of 60 patients and do 83 joint replacements. It's just amazing to me.
It is more than just this week. It takes a year of preparation And so every little bit that our team members do broadens to everyone else back home who is helping to contribute to this cause.
All of the donations go directly to patient care. So whether that's providing equipment so I can do my job as a physical therapist and get people walking again, or to the OR so they can actually perform the surgeries.
Whether it be bringing a walker or a cane or crutches that are gently used to us, that is invaluable. They could not walk out the door with those supplies.
It's things that we look to build on every other week of the year. Where can we get these resources to make sure that we have enough? But there's so much equipment, so many great people, so many great organizations in Pittsburgh and elsewhere that really continue to give back.
We're not 100% dependent on donations. We can't be. Every team member has a target for raising funds.
This team particularly is never going to be status quo. They're always trying to do more and push themselves to do more. I think each year it just keeps getting better.
I never would have imagined that, 15 years ago when we talked about this, and I thought it would phase out, but it became more and more interesting. The patients down here are just so grateful for something they could never in a million years have figured out they might have had treatment for.
We're just centered on the patients, and I think that perspective, if you come here and you take that with you and bring it back home, you can definitely make a difference in the environment that you work in.